Hello everyone. So in today's video we are going to be talking about breast cancer. First of all, we need to talk about incidence and risk factors for this cancer. Next to skin cancer, breast cancer is the most common cancer in women. It is second only to lung cancer as a cause of death. If we talk about age is the most significant risk factor for the development of breast cancer. So, a woman's risk of breast cancer rises rapidly until her early 60s, peaks in her 70s, and then declines. So, this is the pattern of uh, development of the breast cancer in women. Now, if we talk about family history, a significant family history of breast or ovarian cancer may also indicate a high risk of development of breast cancer. Women with strong family history of breast cancer are at higher risk for development of breast cancer. Compared with a woman with no affected family members, a woman who has one first degree relative with breast cancer has double the risk of developing breast cancer, and a woman with two first degree relatives with breast cancer has triple the risk of developing breast cancer. Now, who is your first degree relative? Um, it could be your daughter, your mother, or your siblings, like your sister. So, if any one of them have a breast cancer, then you are more likely to develop it than the person who has no first degree relative having it. So now, if we talk about right lifestyle or reproductive factors, these things also contribute to breast cancer. Nulliparous women or women whose first full-term pregnancy occurred after the age of 30 have elevated risk. Now, nulliparous women are those women who have never delivered or have never given birth to a infant. So those women or women who have full term who had their full term pregnancy after the age of 30, those groups of women have elevated uh, risk factor for developing breast cancer. Now, early menarche or late menopause are also associated with increase in development of breast cancer. Like if there is more menstrual cycles going on in one's life, so there is more risk for her to develop breast cancer. Alcohol consumption and high dietary intake of fat and lack of exercise may also increase the chances of breast cancer. Now, if we talk about pathogenesis, now both hormonal and genetic factors play an important role in the development of breast cancer. About 5 to 10% of breast cancers are um because of genetic reasons and occur in patients with mutation of different genes such as BRCA1 and BRCA2, AT, or TP53 genes. So when there is mutation in these genes, there is chances of development of breast cancer. Prolonged estrogen exposure associated with early menarche that we have discussed previously or late menopause, all of these are causing more exposure uh, to the body of female with estrogen. So there is more estrogen exposure to the body, and that can lead to breast cancer. Or if a woman is having some kind of hormone replacement therapy, that can also cause increase in estrogen exposure to the body. So all of these are actually increasing the chances of breast cancer. There is no definite evidence linking use of contraceptive pills to breast cancer. As we know, a lot of contraceptive pills are also having estrogen. So one may think that breast cancer could also be caused by these pills, but until now we don't have significant data to state that. Now, if we talk about clinical features of breast cancer, the presenting complaint in about 70% of patients with breast cancer is a limb, usually painless, in the breast. About 90% of these breast masses are discovered by the patient. So, patient herself discover that limb and go to the doctor. Less frequent symptoms are breast pain, nipple discharge, erosion, retraction, enlargement, or itching of the nipple. So now there can be some kind of discharge from the nipple or erosion, that is, skin is peeling off, or there is some kind of uh, um, itching around the nipple, or there is enlargement of the nipple, or retraction. What is a retraction? There is that's it means that there is inversion of the nipple, so now it points inward rather than outward. So these things can happen, but these are less frequent. And redness, generalized hardness, enlargement, or shrinking. So both things can happen. Either there can be enlargement or shrinking of the breast. Around 40% of patients will have auxiliary nodal disease. Rarely an auxiliary mass or swelling of the arm may be the first symptom. So this is not very common. Back or bone pain, jaundice, or weight loss may be the result of systematic metastasis. Like when there is metastasis, that cancer has spread from its original um, original place to the other parts of body, then it is called as systemic metastasis. So these signs could be of metastasis, but these symptoms are rarely seen on initial presentation. Distant metastases are infrequently present at diagnosis, and the most common site of spread are bone, that is 70%, lung 60%, liver 55, pleura 40%. Pleura is the membrane or sac around the lungs, and adrenals 35%, skin 30%, and brain 10 to 20%. So now if we talk about 5-year survival rate for breast cancer by stages. So if a patient is on her stage 1, what it means? It means that her tumor size is less than 2 centimeter and there is no lymph nodes. So survival rate for 5 years is 96%, which is pretty much good. And if she's at her stage 2, it means tumor size range from 2 to 5 centimeters, and it can be associated with mobile auxiliary lymph nodes. So now the survival rate will be 81%. If she is at her stage 3, it means that there is chest wall or skin fixation associated with, could be associated with fixed auxiliary lymph node, that they are not mobile when you touch it. That's fixed lymph nodes. So there is chances, 52% chances that she may survive for the next 5 years. And if that patient is at her fourth stage, that means that there is spread of cancer to other tissues or other part of body. That stage is of metastasis, and survival rate is pretty low, which is 18%. So this was all about part 1 of breast cancer. We will talk about some other things in our part 2 related to this topic.